Hello and good morning, everybody. Welcome to our Thursday morning Call the Midwife live. I'm sorry, I actually just had a few problems with the internet there, and for some reason it wasn't working, but we are here now and apologize that we were a few minutes late. If it is your first time here, hello and welcome. I love jumping in here each week, and really my job is just to see if you have any questions or if there's anything that I can help answer you, whether that's about your pregnancy, your fertility, your birth journey, whatever that looks like. I am a registered midwife. I'm also an emergency nurse, and I love just basically getting on here and sharing and helping women with questions that sometimes you might feel like you have to go and Dr. Google, and we all know that Dr. Google is not a good idea. Even as a health professional, I find myself sometimes doing it. At the moment, we're at that age where I've got my own issues with my parents' health, and I find I started Googling things. I was like, why are you doing this, Edwina? Stop Googling, don't Google. So please, particularly when you're planning a pregnancy or you're currently pregnant, it can be a time of a lot of anxiety and you can feel really worried and stressed. So please make sure that you get information from someone like me who's a registered midwife, or from your own midwife or from your obstetrician, but please just make sure that, like everything, it is more enjoyable if you are well educated. And then it takes away a bit of that stress and a bit of that anxiety. Now, I absolutely love knowing who I'm talking to, who I'm chatting to here this morning, where you're watching from. So please do say hello. If you have any questions at all that you want me to answer, you can just pop them here in the comments and I get to answer them for you in real time. A couple of the questions that have already come through in Instagram. So I also do the Call the Midwife questions on Instagram. Hello Farah, lovely to see you here. Tess has said, I have a question. I have a Caesar scar and it's starting to open and be sore. I'm 6 months post. Tessa, any sort of what we would say like dehiscing, which is just a really fancy yucky word really basically, but if when you have a C-section, if there's any sign of infection, if there's any sign that the wound looks different to what it did before, and particularly if it looks like it's coming apart at all, you definitely need to get that checked out ASAP. It might be that there's some wound infection, or it might be that there's some issues from the inside out, but if what you can see looks like that it's coming apart at all, absolutely 100% make it a priority. You're 6 months postnatal, so you probably need to see a GP first. They will have a look at it and they would refer you on. So please make that a priority sooner rather than later. I'm curious, is it sore as well or painful, or have you done something or experienced something where you've felt a pull? Just let me know, but absolutely the priority for you is to make sure that you are able to see a GP obstetrician ASAP. Please, Tessa. Paige, hello and good morning. Greer said, how common are prolapses and are midwives educating their patients to prevent it? Greer, that's such a good question. And like so many things in women's health, like not even childbirth, but just women's health in general, I feel like prolapses aren't spoken about enough. I think there's always more education that can be happening, and I sort of put prolapses in the category of hemorrhoids as well, because I feel like, again, a lot of women will suffer in silence or will suffer with continence, and I don't want to use words that I hope you understand. So continence or incontinence is when you find that you might dribble or have a little bit of urine or have a little bit of what, when you cough or jump or things like that, that's what we refer to as incontinence, where usually your pelvic floor and the muscles that are engaging that and helping that in pregnancy and birth are really challenged. So it definitely isn't something, like it's something that we see a lot of, but it also doesn't mean something that you have to live with, because there is so much that you can be doing, not only to help decrease it, so Greer on that point, but also if you are experiencing a prolapse, continence issues, whether that's urine or fecal, or even if it's hemorrhoids or any issues like that, please make sure that you speak to a health professional. It's not normal. It's not something you should just suffer in. This is a period of your life where we want you to be thriving, not feeling like you're just surviving. So please, if you do have any of those issues, make sure that you speak to your health professional about it. Greer, I think it is a lot more common than what is actually reported. And often what we'll see around prolapses is it's when the woman is preparing for a second pregnancy or a second birth that issue comes to light. And there's a lot of work that you can be doing after you birth your baby around continence and prolapse, just with some really simple exercises, not invasive surgery, anything like that. And that's why I really encourage all women after they birth their baby to see a women's health physio, because that helps. Greer to speaking to what helps decrease it, not prolong second stage, so not really long second stage of pushing. Certain birth positions can help decrease the chances of prolapses as well. And yes, many midwives will work with the women to educate them on that. And that's exactly what we do as well here at Birthbeat. Yeah, Greer's just said, if I had a prolapse and it's playing on my mental health, I'm 3 months postnatal. Oh, 100%. And we've just got to own that. And of course it's going to play on our mental health because it impacts our daily lives. So anything that impacts our activities of daily living, you know, getting up, going out with friends, things like that, impacting our intimacy with our partner, all of those things need to be factored in. So please make sure that you go and speak to your GP and be booking in with a women's health physio, because there is a lot that we can be doing, and we don't want women just to feel like they have to be suffering. It's not the norm. Tessa has said, thank you. It's just sore when it's touched. I noticed it when I had a shower and rubbed over it. Yep, get that one checked out, Tessa. Please let me know how you go. Paige has said, I have my 6-week check on Monday, wondering what is entailed with my checkup. First time mama, unsure what to expect. Awesome question, Paige. So anyone who's currently pregnant, and this is actually advice that I give to all my Birthbeat mums in our online course, because I think with a lot of appointments, sometimes we go into those appointments, we don't know what to expect, and we might feel like we get a little bit railroaded, or we don't feel like we get our questions answered. So firstly, do you have any questions for your care provider? And write them down. So write those down on a piece of paper and go to your appointments with them written down on your piece of paper, and make sure that your answers you get feel like they're answering the question. Sometimes as well, I speak to women, they're like, well, I asked it, but I didn't really feel like I got that question answered. So if you have any concerns or any questions, make sure you write them down. That's what's the first thing. It's an opportunity for you to ask questions. Page for you, depending again whether you've had a vaginal or a C-section or what your birth entailed. It may be having, like if you required some stitches, or if you had a C-section, it would be looking at the wound. So it's an actual physical examination. They'll check in on how you are feeling. So often at the 6-week check as well, we do the Edinburgh Depression Scale, which you would have done prenatally. So when you were pregnant, just talking about how's your mood, how are you feeling. They'll want to look at your general health and well-being. They'll also discuss with you. So at your 6-week check, there's an appointment for you, but there's also an appointment for bub. I'm speaking specifically about what the appointment for you is. They'll discuss feeding. They might, just talk generally about your health and well-being there. But what often women don't know is that they'll also, and they should, if they don't, I encourage them to, is to talk about contraception. This is the time that usually your GP or your obstetrician will also discuss what you're planning on doing in terms of contraception, or what you would like, what your plans are, what your family planning plans are. So that will all be discussed. Plus there's a separate appointment then for bub for the 6-week check, and bub will have their immunizations. So they'll have their needles. It's 2 needles at the 6-week check. They'll be weighed, and they'll talk about certain milestones. They'll go through the blue book and show you the blue book and show what you can be looking at home, and track height, weight, and head circumference. So there you go, Paige. That's an excellent question. And I think often a lot of parents don't know what to expect. But if you are booking as well for the 6-week check, make sure that you book an appointment for you and an appointment for bub. You are now 2 separate people, okay? Often I see people only booking an appointment for themselves or only booking an appointment for the baby. You need 2 appointments now. I also wanted to share with you all, and I'm just going to get the girls to pop it here in the comment box, that we are going to move our Facebook Lives into our Facebook Tribe, which is our closed Facebook group. It just means that we have a lot more creative freedom. We can answer the questions however we like, whenever we like. It also means that I can serve you best because it will be in a lovely, closed, safe, private place. And we already have, I think, 6,000 members in our Birthbeat tribe, and it is truly a beautiful space where mums and dads can just support each other. So please go and check out our Birthbeat tribe. As of next Monday, that's where I'll be hosting these lives. And it is a great way for you to connect with other Birthbeat parents and have, just continue to have this support, because I think that's so important at this stage. Hello, Carly. Good morning. Greer said postpartum. Yes. Annalise. Hi, Edwina. Oakley is 6 months. Do you have any recommendations for weaned? I used to use Infant's Friend, which was amazing, but recalled and still waiting for them to get it back out. Yes, Annalise, and in a similar way to Infant's Friend, I really encourage not only you, but also for Oakley to be on a prebiotic. A lot of my Birthbeat parents find that that helps with wind for them and just that general upset for their belly. So both be on a course of probiotics. And get one from a health food shop. I wouldn't encourage just make sure that you're just comparing apples with apples is what I say, because a lot of what you can buy just at a regular pharmacy, please just make sure that you're getting the right quantity and quality, because sometimes it's 1,000 compared to 10,000. So you're going to want the 10,000. Just be having a look at that, and you might pay a few extra dollars, but definitely better for you and for Bub, for your gut, because you don't want all the extra additives that sometimes can be in there. Yes, around prolapses, yes, 100% they can be surgically fixed, and again, in my experience, so again, this is just my experience, surgery is the later step. So there's a lot that can be done before that around exercises, knowing what exercises to be doing those regularly can greatly improve prolapses and can improve your functioning each day prior to having surgery. So there is a lot that can be done prior to surgery, but yes, 100% there are surgical options as well. So come in and join the Birthbeat tribe, guys. Hello, Natasha, watching from the Hunter Valley. Oh, 5-week-old baby. Beautiful. He has really dry skin on his forehead. Nothing is really helping. I'm thinking it might be eczema. Breast milk isn't really helping. Natasha, it could be eczema. It could also be a bit of cradle cap. Often we can get cradle cap, around here, around the eyebrows as well, and up above the eyebrows on Bubs. Have you tried just a simple oil or something, as opposed, and then sort of washing it off with a baby shampoo, something really, really, friendly. You don't want to be putting anything strong on Bub at that stage. I would try that, because I think a lot of people don't realize that you see cradle cap around the ears and the eyebrows as well. Is the top of his head dry as well? We get a lot of questions around cradle cap. I'd stop with the breast milk if it's not helping, and if you are concerned that it's eczema, I would go and see a pharmacist first, who might be able to give you a little bit of advice, or check in with your GP. But yes, dry skin is a really common thing, particularly in new babies. The reason being, there's a big hormonal shift. So your hormones coming into Bub, getting used to those hormones, but then also releasing those hormones, and it's actually why we see a lot of cradle cap. It's all around the hormones. Paige has said perfect. Thank you, Laura. Hey, my 6-month-old has been waking every 30 minutes overnight screaming. We have tried to teach self-settling. Was going okay for a while, then leap 5 happened. Now he gets hysterical as soon as I leave him in his cot. Laura, are you doing our Birthbeat program? I'm not sure. I can't, sorry. It's hard for me to know. If you are, it does sound to me like it is probably associated with a regression. I'd like to know what you're doing in terms of for self-settling, like how you're helping Bub. Can I just make it really clear to everybody, the way that we teach the Birthbeat sleep program is not cry it out, not leaving them. That's actually not what I guess I advocate for. It's not that it's right or wrong. It's just the way that I teach is probably a little bit softer, only because it's about sort of saying, well, what's sustainable for you and what's also good for bub. So at 6 months, bub's probably a little bit too big now for pat shush. So whether you're calming with a bit of pat shush and pick up, put down, whether you're using space soothing, whatever techniques, and we teach you all these techniques, whatever technique you're using, it really is about being consistent and persistent. So what you can be doing around ensuring that bub expects the same thing each night. And it is really tough when they're going through leaps as well, because they need a lot of extra TLC. And around managing that, whatever that new skill is, Laura, that your bub has learned, really making sure that during the daytime you're filling that beautiful baby's cup, letting them do those exercises or letting them do that rolling, sitting up, giggling, pulling up, whatever it is that they're doing, and making sure that they do it lots and lots of times during the day, and that will also help impact the sleep. But if you're not already, come and have a look at our resources with the Birth Beat Sleep program. That will help you hugely, because that's not sustainable for you and it's not sustainable for bub. So Mama, that is super tough. Chloe has said, hi Edwina, watching from Tamworth. Yay, love seeing the locals. Hi Chloe. How much awake time should my 9-week-old be having, and what tide signs should I be looking for? Thanks. Chloe, again, you should totally come and have a look at our sleep program. It is all there. For a 9-week-old from 0 to 12 weeks, again, you know, bubs need a lot of support, a lot of cuddles. They still essentially believe that they're in utero. They want a lot of support from you. But I would say at around 9 weeks, you wouldn't want more than 45 minutes of awake time, hour max. Now that includes the feed, Chloe, okay? So when bub wakes, getting up, having a breastfeed or a bottle feed, however you're choosing to feed your baby, changing the nappy, saying hello, often that can take 20 or 30 minutes. So don't be thinking, because I teach feed, play, sleep, don't be thinking play is a long time. It might only be a couple of minutes, and then getting bub back to bed and back to sleep. An overtired baby is harder to settle. And particularly in that newborn stage, I see a lot of mums letting their bubs, or thinking that their bubs aren't tired yet until they start crying. And that's usually a sign, a late sign, that they're actually overtired already. So some early tired signs for you to be looking for is actually just bub going a little bit vague and a little bit distant. So they just kind of start staring off into space. So rather than maintaining eye contact with you, Chloe, you might notice that your bub will be looking at you and then just look away and be staring into space. That's actually an early tired sign. You might notice that they get a little bit jittery. Are any of these things looking familiar? Their little hands and their little feet get a little bit jittery. And then thrashing a little bit like that. You might see redness that comes to the top of their eyebrows, and then yawning. And then obviously once they're crying, that's actually getting towards a late tired sign. So have a look and keep an eye out for those things. Courtney has said, my baby girl is nearly 8 weeks old and I'm currently following your sleep program. Awesome, Courtney. And you know that you can also ask any questions, Courtney, in our sleep program as well. So you have that follow-up support. Currently I'm trying to follow it, but I'm very mindful to be flexible and follow her cues. I'm just curious about the nighttime sleep. What would you expect? What would you expect she sleep at night? She's currently doing 5-hour sessions. Does that sound right? Courtney, for I think you just said an 8-week-old, that's amazing, okay? That is amazing. And I think as well, a lot of people saying, oh, my baby was sleeping through the night. That's not actually the norm, okay? Babies need to feed every 3 to 4, 5 hours. So still super early days. So that is incredible. And I'm so glad you have the program and you have that support and you're getting that sleep for you and for bub. It may not stay that, remember as well. But again, just being really persistent and consistent with the sleep routines and following our guides. So that is fabulous. And exactly that, do be flexible. It doesn't have to be, and that's actually why I teach to be flexible, Courtney, because I would feel really anxious if I was like, oh, the baby's got to be asleep at 9:45 and then up at 10:45, and I would actually find that really stressful. So it is about getting to know your baby and getting to know what works for you and your family. So you are doing an amazing job. Well done. Greer just said, thank you. My absolute pleasure. Gosh, it goes quickly chatting to you amazing mums. I'm feeling short of breath. Paige, my baby is 5 days out from his first sleep. Could he be experiencing this sleep early? He only got 4 hours sleep overnight and just needed to be on me breastfeeding. Getting your sleep management this week. Good, Paige. I look forward to you coming and joining us. So how old is Bubba? Because again, sometimes they will just have blocks of sleep and then periods of being unsettled, particularly in that 0 to 12 weeks of age. That is very common, Courtney. Thank you. Appreciate it. You guys rock. Just so you know, this will now be in Birthbeat Tribe. So come and join the Birthbeat Tribe. Please share it with your friends, family, mothers groups, whoever you would like to share it with. And we'll be then hosting our Q&As within the Birthbeat Tribe. Yep, Paige. Okay, that is brilliant. 5 weeks and 4 days. Getting a 4-hour block is brilliant. And look, I will just say it is really tough in that 0 to 12 weeks particularly. You will notice that you will start to get more bigger blocks, but Paige, just make sure that you're getting some rest as well, because I know that it is hard work having them on your chest and feeding through the night. It can be really challenging. A little trick that we also recommend is if your partner can do the earlier in the evening, so you going to bed, Paige, at about 6 o'clock, having an early dinner, having a warm shower, jumping into bed and getting a few hours sleep before maybe the 10 o'clock feed. Your partner brings Bub in, have a 10 o'clock feed, and then get a couple more hours sleep so that you've actually banked 4 or 5 hours sleep before your partner comes to bed because Bub's been sleeping on your partner. And then you know that you've got a bit of sleep in before you're up and feeding and settling through the night. That's a really good strategy for all of you to be thinking about using, particularly in those early days. All right, I will see you on Birthbeat Tribe next Monday. If you want to jump onto Instagram, if you think of any questions in the next day or so, I will also be answering those in stories. All right, team, talk to you soon. I'll put the link here for the Birthbeat Tribe. Okay, bye.